My name is Shannon Visco. This is my schizophrenia presentation for Professor Joy's abnormal psych class. So the article that I'm going to be talking about today is Insight in Schizophrenia, Associations with Empathy by G.H.M. Piernenborg, J.M. Spikeman, B.F. Geronimus, and A. Allman. Okay, introduction. General problem. What general problem was being addressed? It is found that often individuals diagnosed with schizophrenia have impaired insight, and also the relationship between effective empathy and insight in schizophrenia has never been studied before, which is why this experiment was done to be the first one to study this. Context. What is the context? So in order to kind of understand what we're talking about in the rest of the presentation, we have to define the different types of empathy that there are. So there are two main different types of empathy. There's affective empathy, which is shared emotions, and then there's cognitive empathy / the theory of mind, or TOM, as it will be abbreviated in this presentation. So cognitive TOM is knowledge about beliefs of other people via perspective taking, and then affective TOM is knowledge about other people's emotions via perspective taking. Prior research. So what prior research has addressed the issue? So based on several different other studies, this number that I'm about to read has been kind of concluded. So 50 to 80% of individuals diagnosed with schizophrenia have impaired insight. And to define insight a little bit more, it's the awareness of mental illness, relabeling of symptoms, and awareness of need for treatment. And studies have also shown some sort of relationship between TOM and insight. Hypothesis. What specific hypotheses, if any, were tested in this study? So the hypothesis for this experiment were, in individuals diagnosed with schizophrenia, effective empathy will show a stronger relationship with insight than both cognitive and affective TOM. Method. So in this experiment, there were two different groups that had a sample drawn upon for them. So there was the schizophrenia group, and in this group there was 46 people diagnosed with schizophrenia, 34 men and 12 women, and the exclusion criteria was comorbid neurological pathology, psychosis, and IQ score of less than 70. And then in the control group, it was 53 people not diagnosed with schizophrenia, 24 men, 29 women. The exclusion criteria was history of psychiatric disorders, comorbid neurological pathology, and an IQ score of less than 70. And then interventions. What interventions were used includes therapeutic interventions, and in this experiment, no interventions were used. Okay, so measurements. So what measurements were taken? E.g. psychological tests, brain scans, etc. So there's a lot of different measurements and tests that were done in this experiment. So first there's a prosody task. It counted all the correct identifications of emotion by voice. There's the FEEST, counted all the correct identifications of emotion by facial expressions. And there's the faux pas test, which counted all the correct identifications of faux pas, which is an embarrassing or awkward situation that occurs when someone says something they should not have said without realizing that they should not say it. Then there's the EEQ, which is a score on emotional empathy when responding to scenarios. This also measured heart rate changes, skin conductance, and self-reported emotional response in reaction to emotional expression in others. There's the neuropsychological test battery. This included an intelligence test, verbal learning test, planning test, and lots of other tests. And then the last one is positive and negative symptom scale. So it's an insight scale from 1, which is very good insight, to 7, no insight. Methodology and purpose. How does the methodology relate to the purpose of the study? So the variety of measurements taken throughout the study are several different ways that insight and empathy can be objectively measured. These measurements will help to indicate whether there is a relationship between empathy and insight in individuals diagnosed with schizophrenia. Results. So major findings. What are the major findings pertinent to the study's hypotheses? So the schizophrenia group performed worse than the control group for all neuropsychological tests except for the EEQ. All variables except the FEEST were significantly associated with insight. These variables explained 47% of the variance in insight. And then interesting findings. What other interesting findings emerged, if any? So the faux pas test and the EEQ by themselves explained 45% of the variance in insight, which I thought was kind of cool. Discussion. Status of a hypothesis. What is the status of the study's hypothesis? So again, I'm going to repeat the hypothesis. In individuals diagnosed with schizophrenia, effective empathy will show a stronger relationship with insight than both cognitive and affective TOM. So this study found that the relationship between effective empathy is more strongly related to insight than cognitive and affective TOM. Implications. What are the implications of the findings, practical and or theoretical? So since individuals diagnosed with schizophrenia have a hard time with self-reflection, this should be given more of a focus in treatment and therapy. Limitations. What are some limitations of the study? So this study was cross-sectional, making it impossible to come to conclusions about the direction of the relationship between insight and effective empathy. And there were also lots of self-report questionnaires, which are not very reliable. And then most individuals in the schizophrenia group use antipsychotic medication, which might have interfered in some way. And suggestions. What directions might be suggested for further investigation? So these would include like a larger sample size, doing an experiment that's not cross-sectional, and having less self-report questionnaires, and maybe testing self-reflection therapy in a way. Right, here are my citations, my works cited. All right, thank you so much for watching my presentation. I hope you all have a good day.